Second first.
The MHL potting in the corner is now in full outlaw mode. Last fall, we received a YouTube strike for copyright infringement regarding Dr. Hogg's segment on tourniquets. Last week, we received a second strike for copyright infringement regarding Dr. Hogg's segment on draining an abscess along the jawline. Fortunately, the second strike came more than 90 days after the first, so we're still sitting on one strike.
Suck it, YouTube.
Nice.
I love the outlaw Dr. Hogg.
How many strikes do you get?
You get 3 and then you get in trouble, or you can go to school and like traffic school and work your strikes off.
All right.
So I got
you schedule those classes yet?
I got to be mindful of how we do this. So, but yeah, I thought that was pretty fun.
Basically everything we have, we steal from other people. So I'm not sure what.
Exactly. Don't worry. As soon as Elon Musk buys YouTube, we're gold.
I can't believe it. So yeah, none of our stuff's copyrighted. I mean, anybody can grab our YouTube content and do whatever the hell they want with it. So
like,
we want to start. Do we want to start PowerPoint? Do we want to start video? How do we want to do this?
Yeah, I mean, let's see. We can do, so we have a few things, right? We have a special audience participation.
Yep.
Sort of, you guess,
We have 2 audience
who's
participation parts on this one, I think.
Yeah.
So, well, let's do the official announcement first.
Welcome to Trust Me, This Won't Hurt at All with Dr. Hogg. This week, Dr. Hogg will analyze the podcast crew's colonoscopy results and do a special bonus segment as well.
And Chris got here just in time.
You have our colonoscopy results?
We have a couple people's.
Really? Wow. Awesome.
I should have sent you mine if I knew that's what you're doing. I still have my picture.
I think I posted mine when I had mine. I was clean as a whistle.
Same.
Go get it.
No, if you
Get it, Mike.
get it, Doctor. So you want to start with the PowerPoints, Kip, and then we'll do the video.
Eat off your colon.
Hey, Chris, how are you?
Good. How's it going?
Good. Got here.
What did you eat,
something to eat?
I lost what all you have said, so sorry.
Did you have something to eat?
I did. I got a Jersey Mike's sub.
What was the sub?
It was a roast beef. And Dave, I should have beat you this week, but I didn't.
Oh, you're sorry, too late. You missed that segment.
I know. I missed all the segments. I missed all the good stuff.
You just in time for Dr. Hogg.
Can we have your Solly March segment though?
I don't really have a Solly March segment. I'm not thrilled that you have him, but I'm thrilled for him because I had him last year. Here's a kid who they probably didn't start half the games last year, but when they did, they put him in. Like, they never put him in until the 80th minute, but when they did, the guy hustled. Now look at him this year. He's like tied for 11th overall on our league as far as scoring goes. And yeah, so I'm Gulls fan, so I'm happy for him. I'm happy for the Gulls that they're like, up, fighting Fulham for 6th place. But for you, Jack, that has to be just money in the bank that a guy that no one drafted, who, like I said, is 11th in total scoring. You picked, you just picked up after the fact.
Yeah, he could be that Purdy guy of MPL. I don't know where I picked him. It might have been very late. I should actually look at that.
You didn't get him in the draft. You picked him up in August, like August 15th after everything was over. I don't know if the games had started. Yeah.
Okay.
He went undrafted, but I mean, he was like probably 200th in scoring last year, right? So
there's a lot of declaration checks there, Jack.
There were a lot of declaration checks.
Chris, how many goals did he have last year?
You know what? I'm not even sure. I think they said during the game that he's only had 6 previous to that brace. So I would have said probably, did he have 0? Kip, do you know? He had more than 0. I would think. I wasn't paying that close of attention, but he's had, this up until yesterday, he's had 6 goals total. So, Mike, was that a gift or did you buy that yourself?
That was a Christmas gift.
Nice. Very nice.
It'll look nice in Craven Cottage.
If we go, I guess there's still some other options potentially.
Yep, you will look just like the rest of the cottagers.
Play guess the colon.
Oh, guess the colon.
All right, so I'll advance the slides, Kib, and you can. So some of these, I have no idea what's going to happen. Some of them I kind of do. So ready, here we go.
Yeah, I haven't even. Okay.
Ooh, that looks
I haven't-
inflamed.
I have not seen the slideshow, but I will actually. I did participate in some of the picture selection, but so this is interesting. So this is inside somebody's colon. I hope it's not one of us, because that doesn't look good. But I like that. It's easy being a doctor because there's always arrows pointing to where the bad thing is.
Oh,
So
that's
just-
not part of his colon or the person's colon? Is there error? Oh, cool.
No, yeah. I mean, it is part of the colon. It just tells
Who
you where
put
the
them
bad
there?
thing is.
So when you cut someone open, there's arrows pointing to like the colon.
They do. I mean, anybody can be a doctor. I mean,
Oh,
even a caveman can do it. So,
that's funny.
so yeah, the arrows help us, and they point to, some sort of inflammatory thing there that's, not going to be good. You don't want it to be in your colon. Next slide.
Slide.
So, ooh,
Whoa.
ooh.
So this
That
one,
looks dirty.
yeah, well, so this one's hard to tell, but just this, there's a large, like, cauliflower kind of looking mass that's in there. So it's made the colon a lot smaller. So, a lot of times they talk about if you consistently have your stool size is kind of narrow and smaller, and it just kind of not as bulky as it used to be, that could be an indication that maybe something's going on down there. But this is bad as well. You don't want a colon looks like this.
I gotta tell you, it looks like a chocolate filled donut.
Hmm.
And it's making me hungry.
We got a question already.
Kip, just for a refresher, can you explain what the colon does?
Oh boy. Wow. I would think
Curveball.
I would think a man of your expertise in this realm would probably be able to explain that to me better.
Put your hand down, Mike.
I'm putting it down right now. Sorry.
So yeah, the colon basically is just it kind of takes all the fluids out of your sort of waste, and that's how it kind of bulks up the stool and stuff. But it try to get whatever last bit of nutrient out of that, whatever you eat. That's really all the purpose is. And then, maybe it's an area to store things.
Does it
You-
run straight? Sorry, should I raise my hand again? Does it run straight down to the rectum?
So if you look at, the colon starts kind of on the right lower quadrant area, and then it kind of goes up to the right upper side, and then it moves over to the left, and then it goes down towards the colon, toward the rectum. So there's like a couple, there's a ascending colon, there's a transverse colon, then there's a descending colon, which is also called the sigmoid, and then it sort of terminates at the rectum. So there's a few different parts of the colon or large bowel. Dave.
You may have just answered my question, but I was trying to figure out like where does colon figure into the whole digestive thing? So there's like stomach, there's intestines, there's colon, and then you poop. Like where is the colon?
Yeah, like I said, the colon basically is just sort of that last attempt to get whatever nutrient or fluid out of whatever you're ingesting. So it's just that last bit of hope for nutrition.
So it's
Kind of like
before the
FedEx ground.
Nope, I think you spoke out of line there, Mike.
he did. So it's before the rectum.
It is before the rectum, yes.
Okay, and just a quick follow up: the sigmoid colon you said.
Sigmoid, yes.
Who's sigmoid, and is that named after a dude?
Sigmoid, I'm not sure if it's a name of a person. I'm not sure. Yeah, good question. I can't answer that one.
Nice, stumped the doctor.
Next slide, Kip.
Yes, let's move on. Well, this would be Bruce Willis coming out of somebody's colon.
Sorry, 'cause I took a swig. That was a good one.
Die Hard. Yippee-ki-yay, motherfucker. Oh, do we go through my disclaimer? I'm really not a doctor and I know nothing about medicine. Okay.
All right. Now we're to the fun part.
Oh, here we go.
Okay.
There's the rectum.
All right. So can you guess who on the podcast these colon rectums belong to? So these are actual live, footage of rectums and colons and sigmoids of somebody on this pod.
Wait,
We have Dave, I think,
Or
was
someone we
first.
thought was going to be on this pod.
So we're side by side here. So we have two different colons and rectums here. So the one on the right and the one on the left. So
oh wait,
guess
are these two different people?
two different people.
I'm gonna go left is Sean, and right is Jack.
Left is Sean. So my left or your left?
It's left on the
Whatever that
screen.
is, it's on the screen.
The bigger one. Mike, you have a
I
guess?
guess-
That
guess
would be
you
a
got it
negative.
right. Did he get it right?
Well, you have a
That would be
guess?
negative.
So they're both wrong. Okay.
Okay.
Yes. Okay. Go, Mike.
I'm gonna go left is Glenn and right is Jack.
Wow. It's up with the
So
right.
we do have one right answer on that one.
Glenn's right. I mean, Glenn's correct. I said Jack was right on the first guess.
Oh yeah, I thought maybe you went that route. Okay.
Ready for the unveiling?
Yeah. Oh, Dr. Hogg's own rectum.
Look how clean that is.
Yeah,
It's
I've seen your rectum. I that threw me. I didn't think that was it.
beautiful. It is pristine.
Ugh.
And so Dave, actually, I guess you were right on the first one. So the right side is Jack's. Left side is mine.
Well, Kip, you definitely have better lighting on your colon.
Yeah.
So, I mean, Jack, you need to talk to your lighting people.
I photoshopped mine a little bit, you know.
Jack's looks more ominous. It's
Yeah.
circular, and yours, Kip, is more triangular, which is interesting.
It's got more lacing at the 12 o'clock.
Yeah, I was noticing that too. Like the threading is much more loose on Kip's and tighter on Jack's. It's almost like Jack got screwed.
Ooh,
Is it
So-
just because of the angle? But why does yours look like a triangle, Kip, and his looks like a circle?
Yeah, I think it's all just the angle. It's all about the angle.
Who took these pictures? Is it a professional photographer or?
so
I
Kip,
hope so.
So Kip, it looks like yours was done in 2017.
Yes, that would be correct.
So I'm happy to report that mine was done Friday. So
oh, wow.
I am very
Whoa.
fresh and with a very clean bill of health.
Good. Good
My,
to
my colon is Tybee and England ready.
hear.
Well, it looks
Good to hear.
fine. It's a good looking colon.
So Kip, I mean, so it does look good to you, as far as you can
Of
tell.
course.
If you were a
Looks
doctor,
good. If I was a doctor, I'd say it's a beautiful colon.
good.
So,
mean,
now,
not-
a
Not quite as
serious
huge,
question,
but-
Kip.
Yes.
Are you even qualified to look at this and comment on it? Like, would you know
Absolutely
what
not.
a good colon looks like?
Absolutely not.
Like, aren't there special doctors for colons?
They are.
Okay.
Yep. And I am not qualified.
Okay.
I mean, for this podcast, I am, but not for
Right.
real life.
In reality.
All right. So
Do we have any more pictures of your organs coming up?
no, but we're ready to move on to part 2, which is related.
Yeah. So we're gonna go through all causes of GI bleeding, upper and lower. So let's see, share my screen.
Are you sharing on this one or am I sharing on this one? I think I'm sharing.
We're gonna,
Or do you
you want
have
to do the video? You want to do the video first, the YouTube, or you want to do some educational piece? Or
it's up
both?
to you, whichever you'd prefer.
Let's go through. Let's do the YouTube video first.
Okay. So like I need to share that then. Should we wait for Mike to get, oh, Mike's not too far away. So here's our potential second strike starting now.
Oh, it's definitely going to be a strike.
Lower GI bleeds can be a medical emergency as it may represent an upper GI source with rapid transit, and the patient can be hemodynamically unstable and at high risk of death. It may also be the presenting symptom for colorectal cancer. When confronted with a patient with a lower GI bleed, there are 3 things that are critical. First, assess hemodynamic status. Second, ensure hemodynamic stability through
Entering the no edit
resuscitation.
zone.
And third, determine the cause of the bleeding. The initial focus must involve an assessment of hemodynamic status. Is the patient hypotensive or tachycardic? If yes is answered to either of these questions, transfer immediately to the emergency room for assessment and stabilization. The next immediate steps should focus on volume resuscitation. Insert 2 large bore IVs and provide a fluid bolus. Get blood work and remember to type and screen as they may need a transfusion. In addition, assess coagulation status as coagulopathies may need to be reversed.
Dave has a question.
Yes,
What
Dave.
the hell is she saying?
What's a bolus?
I don't
This-
understand anything she just said.
This is medical language. This is.
Can this be translated to English?
Yes, I'll dumb it down to you guys as soon as possible.
Okay, thank you.
Once stable, establish the cause of the bleed. An upper GI source with rapid transit must be considered. An upper endoscopy is often indicated to rule out an upper GI source in the face of hemodynamic instability. Up to half of cases of lower GI bleeding is caused by diverticulosis. Diverticulosis is usually painless. Causes of lower GI bleeding associated with pain and cramping include ischemic colitis, infectious colitis, and inflammatory bowel disease. Hemorrhoidal bleeding is also frequent and typically occurs with hard stools and constipation. Patients will often complain of blood on the toilet paper after wiping. Always consider the possibility of colorectal cancer, especially in elderly patients or those with a positive family history. Rarer causes of rectal bleeding include radiation colitis and NSAID colitis. Colonoscopy is often the necessary diagnostic test to confirm the etiology of lower GI bleeding, and management strategies should focus on addressing the etiology for the bleed.
That's that.
All right, Mikey.
So, several questions, doctor. Starting with the endoscopy, that goes through the mouth and down. Is that correct? And
Yes.
where does that end? Does that just end in your stomach, or like what are we looking for when we're doing an endoscopy?
And has anyone ever made it all the way down through?
So to answer Mike's part of the question, we would say that yeah, they basically look at the esophagus,
Put your hand down, Mike.
the stomach, and the first part of the intestinal tract, which would be the duodenum, which is part of the small intestine. So they actually call it an EGD, esophageal gastric duodenopathy. So it's an endoscopy of those three areas. Once the scope is not really long enough to get much farther past the duodenum, they do make a pill that you can actually swallow. That's like a little, like Honey, I Shrunk the Kids kind of thing. Yeah, like there's a little guy in there and he drives this little thing around into your intestinal tract. But yeah, there's like a camera in there.
And then you poop it out?
And you poop it out, and then you have like a bunch of guys over, drink beers, and you look at your intestinal tract. So it's pretty cool.
Yeah. Can we get a hold of some of that footage? That would be fun.
All right, I'll finish my portion with just the second question. I had a bunch more, but to keep things moving, the stick figure who was, or the little cartoonish guy who was part of the beginning of the session appeared to be a white gentleman. Does this happen to people of all colors?
All colors, for sure. I think this was, I agree. It was not very politically correct, that sketching, and we should involve all people of all races and gender.
Cool.
I think Dave was up, or no, Dave, you had first
Jack was up
question
first.
about, can it go all the way? And that's, again, no, you can't go all the way through.
Is this the racist guy you're talking about, Mike?
Not racist. He just looks like a white guy.
Okay.
Was it wrong being a white guy?
No, not at all. Just wanted to make sure. I was just trying to cover the bases and make sure that I understood that it happens to people of all colors.
It's kind of hard not to be a white guy on a whiteboard.
Yeah.
We are on the verge of a lot of issues right now.
We're going to get more than one strike for this one. So, Kip, I had a question. There was a word in here somewhere that started NS. What the hell is that?
NSAID.
There it is, right there.
Oh, yeah, that's like ibuprofen.
Yeah,
That's like ibuprofen, Aleve, naproxen. It's a non-steroidal anti-inflammatory drug.
Oh, so that's an acronym, not a word.
Yeah.
Yeah, okay.
Dave?
So this segment's about upper GI bleeding. So what are we feeling when we have this, and why would we come see you? Like, what's going on?
Good question. We can move on to the next portion of the segment, and we'll get into some more of that sort of educational. So, yeah, if we're ready, I can share my screen. Do you have any other questions on that video, YouTube, that we're going to get striked against?
Yep.
Okay, let me share my screen. All right. Can you guys see my screen?
Yes.
Okay. All right, let's go. Okay. All right, here we go. So typical presentation of GI bleed. Okay. So your upper GI bleed, there's things like hematemesis. So so vomiting of fresh blood, it kind of gives you a definition there. Coffee ground emesis, that's kind of like exactly what it sounds like. If you're vomiting and it looks like coffee grounds, that's probably some sort of bleeding in your intestinal tract. And then melena is just the description of like a black tarry stool. Dave.
Vomiting fresh blood. Is there vomiting any other kind of blood?
Well, that's a great question, because coffee ground emesis is sort of by definition not fresh blood.
Oh, okay.
So it's going to be sitting in your stomach for a little while. It's not, it's going to come out a little bit later, kind of thing. So that was a great question. You have another one?
How long's a little while?
Yeah.
It depends. I mean, if again, fresh blood, is going to come out bright red, basically. And, if it's been sitting in the stomach or intestinal tract for a while, it's going to change a little bit of color. If it's going to be like a brownish color, it's going to be, maybe a few hours old. If it's going to be maybe black tarry, it could be when black tarry's like stool, it's gone through the entire intestinal tract. So it's been maybe several hours before it comes out, and tends to turn a dark color. And Dave.
When Chuck was vomiting on New Year's Eve, do you think it was fresh blood?
Yeah, I mean, he did heave pretty good. There's actually, we'll move forward with, there's another description of a potential problem with forceful vomiting that could cause a pretty significant issue. But I talked to Chuck, so he's still alive. He did not die. So, and so you kind of talked about some of the symptoms you might have with GI bleeding and stuff, Dave. So they talk about hemodynamics instability. So that's like, your blood pressure is really low or your heart rate's really fast. Syncope is just a fancy term for passing out. So if you sort of pass out or faint, pain, obviously pain, discomfort can sometimes cause, could be an indication of GI bleeding, some fatigue and lethargy. So if you're getting anemic and you're losing blood, you tend to get very tired and fatigued and can't do a lot of stuff. So, and then lower GI bleeding, they talk about hematochezia. So hematochezia basically is just GI bleeding when you're having a bowel movement. And Mike.
Kip, is there a reason you picked this particular issue?
So, I mean, it goes along with our colon picks. So I think that was the big part of it. But I think, especially, I think it's a very important part of our digestive system. And obviously, Mike, I think that this is very, very important to you. So, I just really kind of wanted to educate, this crew. But again, I'm not a doctor, so don't, whatever I say is really not true.
I think 100 English bitters and a bunch of English full breakfasts could lead to some bleeding. So I think Kip's just trying to get us prepared.
Dave.
Hematochezia, you said, was bleeding when you are going to the bathroom, right?
Right.
Which could be confused with hemorrhoids, could it not?
Correct. So you can have, hemorrhoids that can bleed without any patches of stool. So the real difference between hematochezia and then hemorrhoidal bleeding or It's just whether, stool is associated with it.
Gotcha.
Mike,
So you just kind of mentioned something that I was thinking about. I went for my first annual checkup in 5 years last week or 2 weeks ago. And whenever I told Jen I went, she said, "Did you tell the doctor that you poop a lot?" And I didn't, but I was wondering if, because you guys, you've been on trips with me. Do you think I poop too much?
Declaration check. Declaration check.
I don't think annual in 5 years is a thing.
Sorry, just went for a checkup. I just called it annual.
Like, you poop enough for everyone in the whole league. You poop so much.
But is that an issue, Doc?
Yes, that's an issue for all of us.
so I'm going to say that it's better out than in. So I think that you're probably better off than most of us. So I'm happy that you are able to evacuate as much as you evacuate.
Thank you. I'm going to tell Jen that tomorrow.
Wait, I have a quick question.
Yes.
My question's for Mike. Mike, do you poop as much when you're at home, like, I mean, in Pittsburgh, as you do when you're on the road with us drinking? It must be less, right? It has to be. It has to be.
I think I have like 2 really good ones and like 2 frumpy ones a day.
Normally.
Yeah.
Holy shit.
So to speak, yeah.
That's amazing. Okay, my follow-up question for you, Mike, is will you be sharing all your results with Kip, and then can we see them next week on the podcast?
My colonoscopy stuff?
No. We want to dissect. You said you had a doctor's appointment. We want to see all the results.
That was 2 weeks ago.
Well, we want to see the lab results, and we want to go through them.
Well, yeah, whenever I get the lab results back, I'll share them for sure.
Nice.
Because we need to go through them point by point.
I can say my blood pressure, it was 5 feet 10, 170, and blood pressure 110/70.
Wow. Good for you.
Are you any taller than 5 years ago?
No, I'm shorter. I'm 5'10" and a half. I was 5'11" and a half 10 years ago.
Wow,
Wow.
you shrank an inch.
Mhm.
Well,
That's
that should be
impressive.
concerning. Kip, what causes that?
That's not good. It's probably too much pooping.
That's bullshit. It's normal. Everybody shrinks.
You pooped out an inch of your leg.
All right.
Thanks,
All
Kip.
right. You're welcome. I thought I had to go on mute for a sec. Okay. All right, let's move on, right? Let's any more questions on this slide? All right, let's go to the next slide here. And I don't know where I got these slides from. I just found them. So
Strike 3.
just saying. Okay, so potential causes of upper GI bleeding. So there's really kind of, when we talk about GI bleeding, most of those medical doctor kind of people, they distinguish between upper GI bleeding and lower GI bleeding. And as that YouTube video showed, trying to determine what the cause of it is may be helpful and how you direct the management and medical care of the patient, and may indicate, how serious the problem might be as well. So for upper GI bleeding, so certain medical conditions would be like a H. pylori infection, peptic ulcer disease, esophageal varices, alcohol abuse, malignancy, obviously is cancer, and Mallory-Weiss tears. So I know you all have questions, so I will go through each one. The H. pylori is a bacteria that, can kind of like kind of hang out in the first part of the intestinal tract, the duodenum. So if you do, a lot of times when you do an upper endoscopy, they'll take cultures. And if there is some evidence of bacteria there, then they'll also put you on an antibiotic to help treatment. Peptic ulcer is just, peptic means stomach or gastric. So it's basically a ulcer in the stomach region. Esophageal varices, so that's in the esophagus, and varices is kind of like, think of like a varicose vein. So you have these dilated sort of veins along the esophagus. And just like if you ever seen a varicose vein on somebody's leg that gets pretty big, sometimes they can leak and rupture. And they can be pretty bloody. Just think if that's happening inside your esophagus. So it can be a pretty nasty event. Alcohol abuse. I mean, none of us drink much alcohol here, so don't really need to go into much detail on this, but certainly alcohol can create issues with gastritis and other irritations of the stomach, so they could bleed. Jack, you have a question?
The abuse part of that would be helpful to define.
I think everybody has their own definition of what abuse is and what qualifies and quantifies as abuse. I mean, I'm kind of abusing this luster right now. And I'm having fun doing it.
Would you define that as crushing it, Kip?
I'm not crushing it. I mean, I think it is ABV. Mike would know, probably before I would.
5.8%.
Yeah. So
Crushable.
yeah, I think it's for me, probably sessionable. I'm not. So malignancy, obviously cancers. Cancers are obviously bad and they can cause bleeding. Mallory Weiss tear would maybe something that Chuck may have experienced on New Year's. So that's when you're retching so hard that you actually can tear your esophagus. And if there's some blood vessels nearby, whatever you tear into, certainly could cause a lot of bleeding. Jack?
Is that now already from the Family Ties show?
That
I
is.
loved her. Big fan.
She was cute.
Yeah, she actually died, I think, of a Mallory Weiss tear. Dave?
If we had to choose upper GI bleed or lower GI bleed,
That's a better.
which one should we get?
I mean, it's a good question. I'm not sure that there's a good answer. I think none is probably the best answer, but maybe the H. pylori. I mean, that's treatable with some antibiotics. I think maybe that's the way to go. Some of these other ones are not so good.
Yeah.
Jack?
Why isn't there a middle GI bleed?
Well, yeah.
Great question.
Yeah, I do. That's a good question. I think because they have only one point where they've decided that there's an upper part of the intestinal tract and a lower part of the intestinal tract. Whoever voted for middle didn't win. So there is no middle. It's basically upper and lower. And there's a defining point. It's called the ligament of Treitz. And yeah, exactly. Takes a lot more. I'd have to look that up, and I'm not in any professional status to be able to define that. Dave?
I assume the upper GI looks down on the lower GI, just in principle.
Yeah, I think physically, yeah, I think anatomically, you're right. I'm definitely going to look down at the lower. So
I mean, it's like a class of organ.
Yes.
Yeah, I mean, upper class, lower class. I think for GI, I think you're right. I think they're kind of like entitled to the upper GI bleed. They're kind of like
the 1%ers.
They're snobs. Yeah, they're 1%ers for sure.
Okay.
I agree. So medications that can cause GI bleeding. So this is your NSAIDs, which is an acronym for non-steroidal anti-inflammatory drugs. Selective serotonin reuptake inhibitors. Oh boy.
Those antidepressants.
Let's bypass that. Anticoagulants. We all know those are blood thinners.
I am so anti-coagulants.
Yes, I would be.
F coagulants.
Yeah, I am anti-own goal and anticoagulants. So antiplatelets, those are basically just like aspirin type products. There's also things called Plavix and Brilinta, which are a couple of other ones, but so that's the upper GI bleed. Any more questions on the upper class? The prima donnas of the bleeding scenario. All right, let's move down to the lower part of the GI tract and these dregs of society here. So potential causes of lower GI bleeding. So vascular type causes would be your hemorrhoids, angiodysplasia, ischemic, post-biopsy, polypectomy, infectious process. And so I'll go through each one of these. So hemorrhoids, we kind of all know what those are. I mean, and typically those are people that actually have trouble with constipation constantly. That's where you kind of a lot of straining at bowel movements. It can happen. You know, pregnant moms get them quite often. Just the pressure of having a big bowling ball inside your pelvis that you're eventually going to have to put through college and stuff. is definitely causes hemorrhoidal issues. And then the people that are straining and stuff at bowel movements, like Mike probably has never had a hemorrhoid in his life.
No, I did have them. Yes. Well,
oh boy. So
yeah.
Can you
so
get
just
them from
to show
pooping
you,
too much?
Preparation H is awesome, or whatever it's called now.
we're gonna get a strike on that one.
Yeah, way to go, Mike. They should be a sponsor if we're going to say something nice about
It
them.
works, yeah.
So hemorrhoids, angiodysplasia. Again, that's just there's things called AV malformations. There's just a cluster of blood vessels that can occur inside the intestinal tract, and these clusters can start to bleed, and it can be really a pain in the butt, literally.
Nice one, kid.
And then ischemic. So think of when you ischemia. So when you think, that's like lack of blood flow to a certain portion of the body. So if you remember in our previous podcasts and lectures that we talked about ischemia to the heart, where there's like a blockage of a coronary vessel, that type of thing. This is the same thing. If you have like a blockage in maybe one of your intestinal blood vessels, you could then cause some damage to the intestinal tract, which then could then start to bleed. That's called ischemic colitis, which could cause a lot of bleeding. And then post-biopsy or polypectomy. So that would be if you're having your colonoscopy done and the doctor finds that arrow that's pointing towards something bad, then the doctor says, I got to remove that. So they're going to kind of clip it and pull it out. And by doing that, obviously that may rupture a blood vessel or something, so you can get some bleeding from a post-biopsy or polypectomy. Infectious process. So you can get colitis, or like if you get really bad, eat some and go to Mexico, whatever, you drink the water and you get this really bad colitis, or you a third world country or something where you get cholera or some really bad infection that can cause a lot of bleeding. There's also
This is the NHL Podding in the Corner podcast, brought to you by Preparation H.
Okay, we're good.
Perfect. All right, we just we can probably continue our podcast a little bit longer now that we have a sponsor. That's awesome. Mike.
So I have two questions, one for you, one for Chris. I'll start with you. Diverticulitis. I'm sorry, are you just going to get to diverticulitis?
Yeah, we'll get down. That's next on the list or close to next.
All right, I'll pause on that then. Chris, what are you drinking?
Labatt Blue.
Okay.
Yeah. One with what's his name? The hockey
Mike
night in
Lang.
Canada, or hockey night in Pittsburgh guy. Yeah. With all those little sayings he says.
Hockey night in Pittsburgh guy. Like, what are you acting like you don't even know who that is?
Yeah,
Mike
whatever.
Lang. Show some
Yeah,
respect.
Mike Lang. That's the guy. The special Mike Lang camp.
Jesus Christ.
Jesus.
On this slide here, it says diverticulosis, but I've always heard of diverticulitis. What's the difference?
Good. Yes, very good question. So yeah, let's move right into that segment. I think because it'll help Mike answer his question as well. So diverticulosis is just the condition of having these little pouches in your colon. So that's just sort of like the condition. So a lot of us have these little pouches and we have diverticulosis. So if you have diverticulitis, that means that these pouches have become infected. And when that happens, obviously you would benefit from antibiotics. Their complications can occur with perforation or abscess. And then some of these pouches can get really close to blood vessels. And so if this pouch kind of expands into a blood vessel, then you could get some significant bleeding. So diverticulosis sort of sets you up for the potential for GI bleeding, especially in the lower GI bleed. Dave.
So I mean, I know you're not an animal doctor, but I know that kangaroos have pouches. Do kangaroos, since they have pouches, ever get diverticulitis? I'm sure that's happened, right?
Of course.
Their pouches get inflamed.
Yeah, it's not the same pouch. I'm just going to leave it at that. But yeah, I'm not a kangaroo doctor or a human doctor. Just saying. Mike.
Kip, when my sister had diverticulitis, and the doctors elected to remove a part of her, would it have been her intestine or her colon, but they removed like a fairly notable chunk, like a foot or so, because they thought that was the easiest way to address it. And I guess you got some spare parts down there, like you don't need it all. How does that work?
They took a human foot out of her colon.
A foot of colon out of her.
Oh, that's a lot of colon.
Yeah.
So first of all, before I proceed, does your sister give us permission to talk about her colon?
Well, let's just say it was my sister, and let's just say that's what happened. We'll use that as a hypothetically, that was my sister.
We've never met your sister, have we? And why is that?
Never met your sister.
I don't have a
sister.
Met
my sister. Y'all met my sister.
We met Chris's sister.
Yeah, and
we've met Jack's brother.
Yeah.
I have two sisters.
I have two sisters. I have two sisters and a brother.
So hypothetically, Mike, if you had a sister and she had diverticulitis, so yeah, the colon, as we kind of said earlier, that it's sort of like the last bit of way of trying to get any nutrition out of the rest of your food that you ate, the pizza that you had last night or whatever. So if you take that section of the colon out, you do have parts of the ascending colon and the transverse colon. So you still have kind of three portions already. Usually diverticulitis is in the sigmoid colon, which is the descending colon. So you can typically remove that portion and still have a functional amount of colon. If they remove the entire colon, which is pretty rare, then you're going to have trouble. You'll probably never have, you'll probably always have loose stool. It'll come out like water pretty much all the time.
Like
Or
Mark's.
yeah. Or, if they do remove a lot of your colon, then obviously there's nothing to attach it to the rectum. So now you'll have what's called a colostomy, or a bag, because they'll have to hook it up somewhere, and there's just not enough length of colon left to bring it all the way back down to the rectum. So, Dave?
My question's for Chris. Chris, have you ever had any anal bleeding or bleeding like in this manner? And if not, what was the worst disease you got on one of your travels?
Hypothetically.
I have never had any type of bleeding from my anus, ever.
Interesting.
Which, is good. And as far as traveling is concerned, I have never really had any issues in any country, except I kind of, for about 10 days after coming back from Costa Rica in November, yeah, I kind of had the runs, and I think it was because of I did not drink the water, but I was brushing my teeth with the water out of the both the hotels, both down in the jungle and up in San Jose, and I was kind of thinking that was the cause of it, because it didn't happen until I came home, but it happened for a good week and a half where I was, it was things weren't going well down there. I'm sorry,
Did you go
ahead,
up to 4 times a day?
No, I go once a day in the morning, and that's it. I'm sorry, Kip, you have a question?
Yeah, I guess when I'm sharing my screen, I don't have those emojis or whatever. So, Chris, my question, is for you. So, you drink a lot of milk. Do you think that provides some extra protection from drinking as opposed to drinking water?
I don't know. I sure do get an enjoyment out of it. I mean, I will chug milk first thing in the morning just out of sheer enjoyment of it. Straight out of the jug. It is fantastic. It's like sometimes the best part of my day. And I don't know if it helps me, with any superhuman qualities, non-anal bleeding qualities or whatnot. But it's something I enjoy, and yeah.
So you drink milk before you go to sleep, and then you drink milk when you first wake up?
No, normally I'll have a glass with me. I'll take one to bed, but I won't drink it before I go to bed. I will drink it if I feel I need it over the course of the night. But yeah, in the morning, then I'll kind of have a little chug of milk before I make my coffee on most mornings.
Mikey.
It was very easy to find milk in Costa Rica, so that did not become an issue for me.
My question is for Jack. Jack, are we going to have a Chris travel segment on this pod?
I think we just did.
Fair enough.
There you go.
Dave.
My question is for Chris. When you were in Costa Rica drinking that milk, what animal gave you that milk?
I'm assuming it was a cow. The milk was, I don't know that it was pasteurized, but it was the kind of milk, in most cases, that you did not have to refrigerate. So that was a good thing, especially down in the jungle, because what was nice is they always had that sitting there on the table with the coffee. So I'd grab a glass before I'd head up to bed. So it was readily available for me. But it's always nice to have milk that you don't have to refrigerate.
And when you came home, Did the bathroom situation take care of itself, or did you have to like go to a doctor?
No, it took care of itself, but it did take longer than I would have thought. It was like one of those things you think you come back from vacation, and I was like, well, I'll be right as rain after like 4 or 5 days, and it was closer to 10 before I, felt normal with my bowel movements.
So Dr. Hogg, I've been trying very hard to find about this question about kangaroos. They have two
Ooh.
stomachs. Do you think that maybe that's why they don't get diverticulosis?
If I was a animal doctor, I would say that it's probably could be beneficial. Do they have two rectums or just one rectum?
Doesn't look like it. Just looks like one rectum.
Yeah. Okay.
Yep. Looks like D.
Do they have constipation a lot?
Don't know.
Yeah. Okay. Mike.
My question is for Chris. Chris, do they have deer in Costa Rica?
I did not see any. I would say probably not. They have jaguar. They have puma, which jaguars are about the size of a house cat, and puma are a little bit bigger. But as far as deer, I'm going to go with no.
Okay. I didn't realize jaguars were that small. That's pretty cool.
Yeah, I didn't either. And talking to our guide, who has been guiding for years, and he's never seen one, but they do tend to swim across the river. So a couple of the guys who were who were running the boats, see them every once in a while crossing the river. So, but I've never. I mean, in trips to a couple of trips to South America and that trip to Central America, I still have not seen a jaguar myself. They're quite elusive, but one of these days, maybe I will.
My question's for Chris. Chris, you're basically a 54-year-old man. You say you have never had bleeding from the rectum ever.
No, never.
Never.
Have you? No, never.
Oh God, yeah.
Really?
Oh yeah.
See, no,
Oh,
it's
yeah.
not something that. No, never.
Vital, Dave?
Oh yeah.
Yeah.
Oh yeah. It got funky a couple times.
Wow.
Oh yeah. Not pleasant.
You went to the doctor?
The very first time I did, because I thought you were supposed to, and all he did was looked at it and was like, "Yeah, you got a hemorrhoid. Don't strain so much." That was his help. I was like, "That's it? Like, don't you have like a tool you could give me or a paste of some sort?" That's it. So I walked out. And I was like, "Well, I just showed that guy my ass for no reason."
And you paid money for it.
And I paid money for it.
He didn't pay you.
No.
You paid him.
I got nothing from him that I couldn't have gotten off the internet. So yeah, I've had it a few times in the past, and it was very unpleasant.
Okay.
I'm
I've never had
surprised. I
hemorrhoid.
kind of assumed everyone would have gone through that once in their life.
No.
Jack.
I have a question for Dave. Did shark attack have anything to do with it?
No. Shark attack did not have anything to do with it. Shark attack may have helped it. I don't know. For me, it just kind of came out of nowhere. I don't know what happened. I don't strain.
Well, then I have a question for the other three of you. Have you had anal bleeding?
I've had
Are all
hemorrhoids.
three raising your hand for that you have?
Yeah.
Yep.
No.
Hemorrhoids, like a mild, relatively mild case. The doctor in my instance, because I went in. It was kind of at a time I was going for my annual checkup. Whenever I went for an annual checkup, and the doctor said, she said, I'm not going to say you have hemorrhoids, but you have hemorrhoidal tissues that are building, so you might want to keep an eye on them. And I started using Preparation H then, but yeah, I would have some. Some splattering at times, some blood on the TP at times.
Well, okay then.
Yeah.
Are there any more slides?
Oh, so we're still, let's finish up with this slide, and we
Wait a
do
second,
have,
Kip, don't hold on a
we have
second. We may
We
have
got a
data,
bit sidetracked.
we may have data on this. So trying to find, I searched percentage of adult males who've never had anal bleeding. Seems like
Wow.
almost everyone has. So
Yeah, there's ones that
congratulations,
have,
Chris.
there's people that have had it, and there's people that lie.
Yeah.
I'm not lying. I never had anal bleeding.
You're a big fucking liar.
he's
I'm not a
colorblind.
big fucking liar. I swear, this is one. I swear,
You've
not
blown out
something
your
that's ever
ass.
happened to me.
I call bullshit.
Oh, we may be the outliers here, Dave. Look at that.
Look at what?
13% reported for a community based of 1,643 adults aged 20 to 64. 13% reported blood on wiping. So,
Like ever or in that moment?
well, it was in that study. So, well, so anyway.
All right. Yeah, I still want to know about the deer in Costa Rica, but let's move on to.
There are. I confirm. No check on that. There are deer in Costa Rica.
Okay.
Bullshit.
So,
Chris
all
did
right,
not
so
see it.
to move on, so inflammatory conditions for GI bleeding, lower GI bleeding, or infectious process. We kind of went through that a little bit with bacterial infections, cholera, salmonella, other types of colitis, sexually transmitted diseases, not a good thing. And then inflammatory bowel disease would be things like your Crohn's or ulcerative colitis type processes. And an ulcer, you can have an ulcer in the colon somewhere, and that could cause some bleeding. And then your neoplastic origin, cancerous type of things. You have, carcinoma, which would just be, a cancerous tumor. And then polyps. Some polyps are benign, some are cancerous. So, but in polyps, even a benign polyp could bleed and cause some bleeding. And I believe that is, I trying to think of other sort of that didn't list on here, things like trauma. Obviously, trauma can cause bleeding. And you can use your imagination as to what kind of trauma you want to.
Facility Jerry.
What's that?
Facility Jerry.
Facility, yes. I mean, it's a 1 in a million shot. It can happen. So trauma, there's also one that is not very common, but so some people have like an aneurysm in their aorta, and sometimes it gets repaired with a graft. So they put a graft in there, and then that sometimes over a period of time, that graft can kind of erode into an intestinal part of the intestinal tract, and then now you have bleeding from the vascular structure into the intestinal tract, which, as you can imagine, if all the blood in your body is now has a leak into your intestinal tract, what bad things are going to happen. So that's another rare but potential problem. I think that's about it. I think we do have another portion of the segment, which would be now a little bit of audience participation, and actually kind of
I think this is the most important section coming, Kip.
Yeah, I mean, it's to see if you guys really have been listening to this segment. We do have a quiz for you. I'm going to stop sharing.
Ooh.
Okay, before we get to the quiz, I just want to confirm for everyone's benefit, deer are quite common in Costa Rica.
Wow. They're so cute too.
But it does say difficult to spot because poaching makes them shy. So yeah.
Poaching makes them shy.
Jaguars too. So Chris is all over Costa Rica. No questioning Chris on Costa Rica.
There are, plenty of deer. There was one wandering out my backyard as I was taking my morning dump this morning.
All right, so everybody can see that. So,
Yes.
So now we're going to see what we learned by taking a GI bleeding quiz.
Do we need a pen and paper for this?
No, we got all the questions right here.
Okay.
So there you go. Everybody sees question number 1.
Yep.
I guess we should read it for the
In,
non.
in terms of location, GI bleeding is generally classified as which of the following?
The one that's highlighted. Oh, sorry.
Just happen to be where the cursor was.
Upper and lower. Yeah.
I would say upper and lower.
Right,
Do
upper.
we have a consensus? All right.
Moving on.
That's move on. The number 2 question is upper GI bleeding may be caused by all of the following except.
Gastritis.
Yep, gastritis.
But read the question carefully.
Except.
Upper GI bleeding may be caused
Oh,
by
upper GI.
all of the following except. It's a trick question.
It's a trick.
Oh, colitis.
Do we have a consensus?
Sure.
Chris, yeah, on colitis.
I'm gonna go with
Can only go with one.
I'm going to go with peptic ulcers.
All right, so I have to
Sure.
break the tie, and I'm going to go colitis as well.
All right, moving
Why
on.
should Chris get a vote? His anus has never bled.
Number
I don't
3.
know about my upper gastrointestinal tract, but no, I've never pooped blood.
Yeah. Number 3. What is the most common cause of upper GI bleeding?
Cancers.
Fistulas, cancers, peptic ulcers, or esophagitis.
I
Cancers.
can't remember if the peptic is the peptic upper.
Remember what we saw? What was peptic? Peptic is another term for gastric, maybe. So gastric would be probably
Lower, right?
We didn't hear the word fistulas in the whole.
Did you guys listen? Did you guys listen?
Well, like,
Cancers.
I thought gas came from the bottom. All right. If that's not right, then I would go with peptic, because not a lot of people have cancers. A lot of people get ulcers, so I would go with peptic ulcers.
Ulcers.
Ulcers. Chris, you're good with that?
Fistulas.
I'm going to go with Chris on that one and break the tie. Well, it's a tie. So
I can't remember what fistulas is, but I'm not hard.
I'm clicking fistulas and moving on.
That's fine. I'm not hard and fast on peptic ulcers.
I've seen some videos with fistulas.
All right.
It's
I bet
not
you
hot.
Question
It
4.
is not hot.
I love that you call it fistulas. I mean, if I was a doctor, I would call it fistula, but I'm not a doctor, so fistula sounds great.
Fistula.
Number 4 is esophageal
Before we go back,
varices.
so is the answer we picked has something to do with people's hands? All right. Question 4.
That's a whole new podcast. Number 4, which of the following conditions is not a cause of lower GI bleeding?
Esophageal.
I agree.
I'm with Mike on that.
All right, we have a consensus on that one. All right, good.
Remember the
Jim.
varices word from the first part.
Yeah.
Oh, we got to
Number
write
5,
So-
fill in the blank. So we have a dark tarry stools are associated with blank, and it's upper or lower. You only have two options here.
Upper.
Gastrointestinal bleeding.
I think it's upper
Absolutely.
because it takes time to get dark.
Somebody was listening.
We're all over the upper part.
Yeah, that's
Which
As
Number
soon as Dave asked Chris about him, we lost the focus completely.
Number 6. Which of these listed is the medical term for vomiting of blood? Hematuria,
Hematochezia. Hematochezia.
hematochezia, hemoptysis, or hematemesis? You guys were not listening. Which
Hematochezia.
of these listed is medical term for vomiting of blood?
Wait, hematometemus.
I thought it was that. Yeah.
Yeah, that's what it is.
All right.
Yeah.
Yes.
So yeah, break it down, right? So
Oh.
emesis, what's that?
No
We
idea.
all know what emesis means. Come on.
It's like pucasis,
Exactly. So, and heme is what?
blood,
Right. So what's the answer?
puke and blood.
Yeah, or hematemesis. There we go.
Yeah.
See, we figured it out. Number 7. An
How many
enlarged
questions are there?
Fistula.
of 15,
All right.
115. This could go all night. Number 7, enlarged bulging vein in the
This is
esophagus
hot.
can rupture at any time, resulting in massive bleeding. What's the medical term for bulging esophageal veins?
Did you teach us this, or are we guessing on this one?
What's that?
Did you teach us this
I
one?
saw-
Or are we guessing on this one?
I
Oh, I
saw
think we-
bulging veins in that same
Yeah,
video.
remember we did talk about varicose veins,
Oh,
so I
that's
think
right.
we
Yep,
should have this answer.
Is it stricture? Because that's like, well, no, stricture would be tightening. So we want whatever the opposite of stricture
We want
is.
bulging. Yeah.
Yeah.
So
Is it that bottom one, or I can't remember varices?
Remember we talked about varicose veins.
Oh, there you go. Boom. Varices. Yeah.
I like
Great.
taking tests with Kip.
Yeah.
He just gives us the answer.
Just hinting. Number 8, apart from blood in the stool, which of the following may cause black, tarry stools?
Whoa.
So what kind of things can cause that?
yeah, when I take Pepto-Bismol, I'm black as black can be.
Black as
I've had beet salads before, and my shit is black as fuck.
Well, they tell you when you're doing, as Kip and I know with recent colonoscopies, no red anything the day before.
Oh yeah. Yeah, like no red
No red Gatorade, no red Jello.
Jello.
The day you can't eat. Yeah.
Yeah, that's right. So it must be that one.
So we narrowed it down to 2 because we know that Pepto-Bismol does it.
Yep.
And apparently, according to Mike, that beets and red dyes do it. So I think we have to narrow it down between those 2. I don't think gallstones and diarrhea.
Right. Yeah, that's a different spelling.
I think this is an English test. So yeah, one of those 2. It may be controversial.
Maybe both.
All right, number 9. Which of these drugs can predispose to GI bleeding?
Did we
Ibuprofen.
talk about this?
Ibuprofen, you talked about like aspirin. Like,
Yeah. Okay. That would be the one that I would think of too.
Non-steroidal anti-inflammatory. Perfect. You
Yeah.
guys did listen. That's awesome.
Yeah.
All right, number 10. Which of the following microorganisms is a common cause of gastric ulcers?
H. pylori.
Boom.
My best student, yes.
you agree, Chris?
I agree.
Number 11.
Yes, finally.
Not every person with a GI bleed will experience a change in stool color. For some individuals, blood in the stool can only be detected through laboratory assessment for occult blood. True or false?
Cold blood.
Cult blood.
Just like New Orleans shit.
Like used in
Yeah.
the ceremonies?
Exactly. So this is blood that you can't see. It's like stealth blood.
Oh, is that what a cult means? Ah,
It's like
that's pretty cool.
Jim
Makes sense.
Crumley blood.
Makes sense.
I think that's false.
I don't
I
even
think
know
that's
if it's a
true.
question. Pass.
So So let's put it in our sort of terms. So can there be blood there without actually visualizing red blood?
I would think so. Could be traces that you're not going to see.
I agree. True.
Okay.
Feels like he wants us to say true.
Wants us to say true. That's right.
I want to say false.
This is like the non-fresh blood
Mm.
question. We started this whole thing.
Yeah. My life's not going to hang in the balance, but so whatever you decide, but it feels like that's pretty straightforward, that you could have traces of blood in your stool and not see it.
Yeah, Chris.
No, that I agree with him. That's what I said. True.
No, you've had blood in your stool and didn't tell us.
That's right.
I really have not.
All right.
He has probably had blood, but just didn't see it.
I think we're wrong on that one, but okay.
Whatever.
Number 12.
Number 12, which of the following procedures can be done to determine the cause and sometimes stop upper GI bleeding?
You talked about the sigmoid and the colon. I think those are both down low. So it would be the esophageal endoscopy. I'm saying that super long motherfucker.
I'm going with the bronchoscopy because of Kip's broncho.
Let's break it down. So everybody
you're
agreed.
wrong.
Everybody agreed that colonoscopy and sigmoidoscopy are lower, correct?
Yes.
Yes.
I never agreed to them.
And then so bronchoscopy. So what do we
Broncho's
think about
breathing, right?
broncho? What are we thinking where the bronch might be? The
Riding the
broncho.
horse.
It's like bronchitis is breathing, lungs, right?
Right. So where would you be scoping for a bronchoscopy?
You scope in your lungs.
Exactly. Chris, you want to change your answer?
Airway. And,
No, I want to keep it that way.
and the
Chris.
esophagus
Got all-
It's
Got
too
everything
hard to
covered.
pronounce.
That's like a Welsh word. It's got everything covered. So we're good on there.
Yeah, we got gastro in there. We've got endo in there.
So
It's got the most letters. It must be right.
I heard Kip say duodenum at some point, so it's got to be it.
Remember, I call it an EGD. Let's just call it
Oh yeah,
EGD.
boom. Yeah.
A lot easier. All right, number 13. Which of these causes of lower GI bleed can lead to colorectal cancer if not detected and treated early?
Polyps.
Vascular malformation.
Now he's just being a naysayer.
Diverticulitis.
Oof. We're all over the board on this one.
So just put hemorrhoids.
Hemorrhoids is just inflammation of the
Butt.
end
The
of your
butt.
buttocks, right? So that's not going to cause cancer. I think it's the
There you go.
polyps.
It's between the polyps and the hemorrhoids.
Hemorrhoid. It's polyps.
Diverticulitis.
I did the hint. It's crossed.
I disagree with this.
You only get 3 hints, so you're
This is
used
a
to. Oh,
Big mistake.
Oh yeah, we
I
still
know that
have.
they say they're going to shave the polyps when you get a colonoscopy. So let's go polyps.
Yeah, we have 2 hints left, so we're good. All right. So number 14, treatment of massive GI bleeding may include all of the following except.
I hate
Except.
those questions where they do the except.
Except.
I call that bullshit.
I don't know how a blood transfusion would help with the actual bleeding itself. You're replacing blood that's lost, but it's not helping with the actual bleeding. It seems like the rest of them could actually help with the bleeding.
But it could help you from bleeding out.
Yeah. I mean, maybe the stomach acid thing.
All right, let's break it down a little bit. Let's look at each one individually. So you're bleeding from you're bleeding to death. You have a massive You have a massive GI bleeding. You're coming to the ER. You're coming to see, well, hypothetically, you come see me because I'm not really a doctor, but you come see me and you're bleeding heavily.
All right, so transfusion makes sense then.
Yeah,
Seems like
I'm probably going to
surgery.
give you, I'm going to give you blood, and then
Surgery to stop the bleeding, so you're going to repair something.
yeah, so I'm going to call probably a surgeon or a GI doctor and say, look, this guy is bleeding to death. We need to do something. So surgery is good. And then the other things, these two are so medications to reduce stomach. So that would be like if you're going to give them like Protonics or some other medication. Let's say you have an upper GI bleed, a peptic ulcer. Will giving medications help with that? Is that a part of a treatment plan? So that's what you have to consider. And then always good to go back and recheck your answers. So medications and then antihypertensive medicine. So those are medicines that you would use to lower the blood pressure. And
Okay. Yeah.
the question that I would say, okay, when somebody comes in with a GI bleed and they're massively bleeding, are they going to be having a high blood pressure or a low blood pressure?
Probably lower then, right? Because you're losing blood. So you're.
Yeah. So would you want to give them a medicine that would lower their blood pressure?
No.
So all the following except.
So how does reducing stomach acid, is it because the acid maybe is creating the ulcer or whatever the issue is? Okay, boom. All right. Yeah. Antihypertensive medication. We're there. We're acing this motherfucker.
We just have to have Jack change the answer.
I change that one.
Yeah. Number 15. All right, I think this is the last one here. Prevention of GI bleed may include all of the following except. Another of Dave's favorites, except.
I refuse to answer any questions that say except,
This one.
including this one.
All right, so stress management, will that help to prevent GI bleeding?
It like, aren't ulcers sometimes associated with stress?
They can be.
So you would think that would be a potential, treatment is stress management to reduce impact of ulcers.
Okay. And then antibiotics to treat an infection, right? So would that help if there's no infection there, an infection that could cause bleeding? So if we stop the infection, would that work?
You would think, but you would think, yeah.
So if we stop, let's see, lifestyle changes such as alcohol and smoking cessation, would that stop maybe?
Mike can't do that. Only on Mondays.
There are 52 Mondays, remember.
Yeah, but you don't do all 52.
That's true, but I still do more than a month's worth. So yeah, I'm gonna go. So
the last one, let's say, would you want to like just pound a bunch of Advil, ibuprofen before meals?
That's all anti-inflammatory is?
Yeah.
All right, then that's our answer.
Yeah. All right.
See how we did. First one.
Right.
Second
good
one.
sign.
Right. Thank God we didn't listen to Chris on that one. 3 for 3.
Good thing you went back and changed that one.
Yep, absolutely. 4 for 4. Ooh. So it was not the Pepto-Bismol. Oh no, it was the Pepto-Bismol.
Yep, it was Pepto-Bismol
Damn.
and
And
iron.
blueberries. Yeah. All right.
I think you have to eat a lot of blueberries, I think, before you start changing the color of your stool.
It's the only one we got wrong.
That's right. That's,
That's pretty good.
beets
And
or,
that-
beets or
That was kind of
blueberries.
controversial.
Are we doctors now?
14 out of 15.
You're at 93%. That's pretty good. Yes, you guys are all now doctors. Thank you.
Even you.
No, I am not a doctor.
Allegedly.
Good segment.